And the next award is for Sustainable Concrete Construction, the Bridgeport Active Healthcare in Toronto. Team members, Bridgeport Active Health, Stantec Architecture, KPMB Architects, HDR Architecture, Diamond Schmidt Architects, Halsell Associates, PCL Constructors Canada, Alliance Forming Limited, and St. Mary's CBM. Please come forward. The Bridgepoint Active Healthcare in Toronto is the largest facility of its kind in Canada, focused on the treatment of complex chronic disease and rehabilitation. The design response recognizes the role landscape, nature, and community play in supporting health. Bridgepoint is the manifestation of the belief in the restorative power of good design, and by using a concrete structural framework, they were able to meet these goals. The building envelope incorporates durable and low-maintenance materials, including local stone, concrete, zinc metal panels, and IPE wood. Architectural details, texture, and finishes de-emphasize the feeling of being in an institution, and instead they offer comfort and provide an appropriate human scale and a feeling of intimacy. We have a speaker, please.
Good evening. My name is Antra Rose. I'm the project architect on this from Diamond Schmidt Architects. It's a great pleasure to receive this award from the Ontario Concrete Awards on behalf of Bridgepoint Active Health. What started out 17 years ago as a bid to close down the existing hospital ended up as a vision to create a new kind of healthcare system in a new kind of building. Bridgepoint is a civic building. It's an urban center in which healthcare and community come together. The design is a response to a vision that recognizes the role of landscape and nature and community and how they play and support health. The building capitalizes on its spectacular view, great view of the park, natural light, access to nature, and a fabulous view of the city. It ensures that patients are constantly connected to the world outside. They can see their communities and be encouraged to go back there. It inspires patients to participate actively in their healing process. So we believe that Bridgepoint really is a manifestation of the belief in the restorative power of good design. And using concrete helped us reach those goals in a very major way. Bridgepoint Health opened a year ago, the hospital itself and the renovated Don Jail. I encourage you all to go have a look. It's open to the public. Up until now, they've been using half the building, one access and part of the site. The other half is just finishing up now because the existing half-round building was taken down and the newer of the jails, Toronto Jail, was removed, and now the east side of the building is accessible. So that means early in the year, much more of the site will be available to the hospital. The building envelope and hard landscape incorporate durable and low-maintenance materials, including local stone, concrete, zinc panels, and ipe wood. Architectural details and finishes de-emphasize the feeling of it being an institution, and they provide comfort and an atmosphere of human scale and intimacy. In fact, so much so that we got calls all through the project for people driving by in the Don Valley and saying, "So when are those condos going to be ready?" You don't want to say what you have to do to get in. Concrete allowed us to form massive post-tension concrete beams that allowed us to support an indoor pool over our mechanical space, to provide 5 large loading bays underneath the patient in clinical spaces and over 2 levels of underground parking. They allowed us to create very long spans that transferred loads between the very regular grid of the clinical floors above to the very irregular grid of the loading bays and the service spaces below that. Forming the extensive accessible terraces and landscapes out of the concrete allowed the design to meet the requirements of the rehabilitation focus of Bridgepoint by providing smooth and clean and navigable spaces that are hard-wearing and aesthetically pleasing. The terraces and steps and ramps are used to teach people new mobility concerns, how to move through the city with confidence as they heal. We worked very closely with Alliance to perfect the form and finish of the exposed concrete to ensure that patients felt comfortable amongst the concrete and that the surrounding community would be encouraged to come through the building and stop and enjoy the contemplative gardens and even the labyrinth. I think there are images, good timing, of the labyrinth on the north side of the building. It's nested in facing Riverdale Park, surrounded by glass windscreens and planters, and it serves as a quiet meditation space. You walk endlessly around the labyrinth, but it's also a great space for functions, and in fact, the hospital holds wheelchair races there. This particular element required considerable research and many mock-ups. Alliance had to reach back into their library of concrete mixes to find that perfect salmon red that the architect insisted on that would not fade to pink. And also to form the complicated pattern without providing trip hazards or hazardous issues for people who have to shuffle through the space. We really had to put our heads together and figure out how to form this space and make it work for the hospital. We were lucky really to have an excellent team. This was a P3 project, and anyone who's worked on a P3 knows that it's just a tad complicated. We had a great planning, design, and compliance team, the PDC team, that worked with the hospital originally to come up with a programming and schematic design, and then they continued working with us through the rest of the design, build, finance, and maintain with PCL and plenary to develop the design into construction documents. So at times we had 6 architects in the room from various firms, along with the trades, trying to hash through problems to kind of come up with functional solutions with the user groups and the clinicians to make this new building, this new rehab building work. It was not easy, but it was very collaborative, and I think we've ended up with an excellent building. And your recognition proves that we were successful in our endeavor. Thank you very, very much. We're very appreciative. Please go out and have a look. You can get in and walk around. You don't have to break a leg. And have a wonderful evening. Thank you very much.